Good morning, my name is Chris. I'll be your instructor this morning. Brief history on me. I'm a former member of the State Search and Rescue Team in the state of New Hampshire. I'm currently a nationally registered EMT as well as licensed in the states of New Hampshire and Virginia. More importantly for you, I'm a certified American Red Cross instructor certified to teach this class. Go around the room, say your name and why you're getting certified or recertified today.
My name is Ashley, and I'm a teacher at Prince William County, and
I'm Rachel Bon Jovi, and I do mobile crisis response for mental health for children.
Okay.
My name is Caitlin, and I'm going into nursing classes at UCPI.
Okay.
I'm Sharon Talbert. I'm a CNA, so I mean from a
Yep.
I'm Sandy, also teacher for.
Okay.
I'm Courtney. I'm trying to get my licensure to be a music teacher.
Okay.
My name is Nowroz Rashid. I'm a construction manager of Gannett Plumbing on 66 Widening. I was required to take it.
Okay. When I give you a scenario, I try to make it a little realistic, so I'll try to give you something that matches kind of everybody. I'm not able to do it, but I try. Okay. So we're going to do a quick review. You'll have a chance to practice. We'll do a little more review, and then it'll be the practical part. Okay. So what's the first thing we do come upon a scene or situation?
I'm sorry, I can't hear you.
First thing you do when you come upon a scene or situation, what are you going to do?
Look around the scene.
Yeah, make sure it's safe, right?
Yeah.
Click right, click left, click back to center, training, right? In all seriousness, you want to make sure the area is safe for you. Okay? Don't just look. Look, listen, smell. Make sure it's safe for you. Because if there's a gas leak, if you just looking, not going to do any good, right? If it's electrical, you might hear it, you smell it, or it could be a potential crime scene, right? Just make sure the area is safe for you. After we make sure the area is safe, what are we going to do?
Introduce yourself, get a consent.
Yeah, if they're responsive, go ahead and get consent. Tell them you're trained, you can help them, okay? If they're unresponsive, what are we going to do?
Implied consent?
You have implied consent, exactly. So they give you verbal or a positive response, you have consent. You have implied consent. How are you going to check for responsiveness?
Are you okay?
Yeah. Shout, tap, shout. Hey, are you okay? Hey, are you okay? Now, when you go to tap them, you need to try to wake them up.
Yeah.
They're going to go, okay. Not going to work, right? So after we check for responsiveness and they don't respond, what are we going to do?
Can we tap them again?
Yeah, you didn't shout,
Okay.
yep.
If there's a bystander, ask them to call 911.
Yeah, we're going to do that, but we're going to do one other thing real quick before we tell somebody to go call 911.
Make sure they're okay.
We're going to check for breathing,
Yeah.
okay?
Wow.
You're going to lean down. You're going to look, listen, and feel. You're looking at the chest as you're listening and feeling to see if they're breathing, right? Because they're really a heavy sleeper, we don't need to call 911, right? They come, okay? Check for the breathing. After you're done checking for breathing, then you're going to tell someone to go call 911, right? Hey, go call 911. Does that work?
Yeah. What
No.
about the AED?
Well, you want to identify the person that you're sending the call. If you see just go call 911, you'll have what's called the bystander effect. People will look around, oh, someone else is going to call, I don't need to. I'm going to stand, I'm going to do CPR for 20 minutes or so, realize no one's called. I'm going to get upset and throw in some adjectives and no one's going to have a good day, okay? Be specific on who you identify to go call 911. So it'll be you in the purple sweatshirt, go call 911. You in the tie-dye shirt, go get the AED. Okay? No, leave the chair there. You have your online completion?
Yes.
Can I see that, please? All right. Go ahead and grab a pair of gloves and have a seat right there where there's a mannequin. The reason why you send one person to call and the other person to get the AED, if you have multiple people, you'll have a quicker response. The person going to call is going to go call, they may be on the phone a while with the operator and dispatch. The person finding the AED may get back quicker. If you just send one person, it may take longer, okay? So we send them off, now they're not breathing, what are we going to do?
Start using your.
Immediately start chest compressions and CPR. Number of ways over the years to find where to place your hands to give chest compressions. The base of your hand goes on the sternum, the hard center bone in the middle of your chest. Miraculously, our middle finger is the middle of our hand. Don't know how that works, but it does. Okay? Base of your hand on the sternum, middle finger across the nipple line. Lace your fingers together, keep your fingers raised. Lock your elbows, get your shoulders directly over, and then compress. Okay? How far am I going to compress the chest for an adult?
2 inches.
At least
2.
2 inches. Okay? How many compressions am I going to do?
30.
30, then what am I going to do? You're going to give 2 rescue breaths, right?
Yeah.
Head tilt chin, pinch the nose, make sure you have a good seal the airway, and then do 2 quick rescue breaths. Now, with COVID going on, how many of you want to go give mouth to mouth to somebody? We're all wearing masks, doesn't make sense, right? There's some things you can use to protect yourself. One is a face shield. One of these, they come in a lot of first aid kits. They tell them to carry them on the keychain, place it over the face, cotton area goes over the mouth, it tells you where to pinch the nose and keep your fingers, okay? That's one option. The other option is to use a face mask. When you take the face mask out, it's going to be flat. You need to push it up. Don't try to use it flat, it won't work. If you do, this will get in the way of the mouth. This does not go in their mouth. Pop it up, okay? Pointy end goes towards the nose, squishy side goes towards their face. Put it over, do the head tilt chin, raise it up, then push down on the mouth, and you breathe through the tube, okay? You want to put the strap around them too, okay? How many patients can I use this on?
1.
Exactly. And what am I doing with it? Yeah. Okay. How do I check for responsiveness on an infant? Tap their foot, right? Baby, are you okay? How do we do compressions for an infant? 2 fingers straight up and down on the chest, right? Unless you have long, sharp fingernails. If you have long, sharp fingernails, do not go straight up and down.
You use the knuckles, right?
Use the pads of your fingers.
Okay.
Yeah, just use the pads of your fingers. Yeah, you go straight up and down, you might create a puncture wound, really messy, not a good day for you, really not a good day for the infant, okay? How far do we tilt the head back for an infant to give rescue breaths?
It was never settled.
It's just to neutral, it's just to neutral, okay? Where the adult and the youth will tip it further back. An infant has a negative head posture, so that, they're always looking down. That's why we have to support their head, right? Just lift it up so it's in line with their body. It's just too neutral, okay? We give you 2 rescue breaths. All right, we started CPR. When can I stop? Well, when can you stop?
After 2 minutes.
What are you going to do after the 2 minutes?
If someone else is there, the rescue squad is there. Someone take over.
So the 2-minute thing, yeah, if you can't call, if there's no one around, you don't have cell service, you can't call for help, do 5 cycles, which is approximately 2 minutes, go call for help, come back and resume CPR, so you're not really
You
stopped.
have to turn them over in the position, what is that position?
Recovery position?
Yes.
But if you do it for 2 minutes and they're still not breathing,
You keep going until you get an 80.
you keep, yeah.
I mean,
it's
if you
not,
have someone there, right?
right, but once you go and call, you're coming back and resuming CPR, you're not stopping CPR, you're pausing it. When can you stop giving CPR?
When a rescue squad comes to take over.
When EMS comes and they relieve you. When they relieve you. I say that because when EMS shows up and they walk into the room,
You stop.
don't stop. Please don't do that. Okay? It happens. Don't do that. They will take over for you. I'll let you in on a little secret. If you're doing CPR correctly, guess what they're going to do?
Let you continue.
Let you keep going until they're ready to take over. If you're tired, tell them, hey, I've been doing this for 20 minutes, I need someone to take over for me quickly. They'll speed it up, okay? Don't, when they walk in the room, oh, you're here, I'm done. Don't do that, please, okay? EMS arrives and relieves you. When else can you stop? Thank you. You're too exhausted to continue. Thank you for not saying tired. Most people say when they're tired. You will do 2 minutes of CPR this morning, and I will tell you, you will be tired after that. You can still keep going. Okay? EMS relieves you, you're too exhausted, when else can you stop?
When they become responsive.
Yeah, they become responsive, they start breathing, or if they say, ow, don't bang on my chest, hopefully you do that before you stop before they say that, right? You realize they're breathing. When else can you stop?
If you have the AED machine to attach your...
Yes and no, you're still going to do CPR. The AED will tell you to continue CPR as needed, okay? What's the first thing you do when you get there?
Check your surroundings.
Well, if the scene becomes unsafe.
The scene becomes unsafe. If the scene becomes unsafe, you can stop CPR, okay? Or if someone else is trained relieves you. Doesn't have to be EMS, right? So you're all trained, you're doing CPR, one of your fellow teachers comes over, they can take over for you, right? As long as they're trained, okay? If someone else is trained, takes over for you, EMS arrives and relieves you, they have signs of life, you're too exhausted to continue, the scene becomes unsafe, okay? Those are the times you can stop giving CPR, all right? So you sent the person to go get the AED, they come back with the AED kit and first aid kit. Every AED kit is going to have a number of things in them that are exactly the same. There'll be an AED, there'll be a set of pictured instructions on how to use it. There will be at least 2 types of pads for every type of pad in the AED kit. A pair of trauma shears and a disposable razor. Question, the person that brought it back is not trained. Who should attach the AED? You or them?
The person that's trained.
What are you doing? When they come back, what are you doing? You're doing CPR, right? You're providing those chest compressions. When we provide chest compressions, what are we doing? We're circulating the oxygenated blood to the vital organs in the body, right? Have them attach it. You can tell them what to do. There's the pictured instructions. The AED talks to you. There's pictures on the pads, okay? Because you're still providing the oxygenated blood to the body. Have them do it, okay? What are the trauma shears for? What do you...
Can I ask you a question? I'm sorry to cut you off. Like I said, if you were saying to have the other person attach it, the one that is not qualified to do it, I mean, if the person has hair or anything like that, are they able to shave or do we have to shave?
They can do it.
Okay,
Have them do it. You're still giving CPR.
okay,
You're still giving chest compressions. Have them attach the pads as you're giving chest compressions.
okay.
Okay? So, what are the trauma shears for?
Cut the...
Cut the clothing straight down the middle. Works most of the time, right? Why do I need a razor? I think someone mentioned it. Chest hair, right?
Yeah.
So, you open up Mr. Jones's shirt, and you find a carpet full of hair. And you go, I got this AED pad. I need to stick it to that chest. There's no way it's going to touch skin because there's so much hair in the way. What are you going to do?
Have the person shave.
You can do that. This is my opinion only. Probably shared by other people, but it's my opinion. I would take the first set of AED pads. I would stick it where it needs to go. I'd squish it, and I would then rip it off and apply the new AED pad. It's a lot quicker than trying to use that disposable razor. Okay? Your choice. Time is an essence. The field wax job is probably quicker than trying to shave it. Okay? So where do I apply the AED pads for an adult?
Upper chest.
Right below the right shoulder, underneath the left breast area, right? Apply the pet. Most important thing to do with the AED is
Turn it on.
turn it on. Once you turn it on, I'm going to borrow this one for a minute. There was a recent study done between a group of 3rd graders and a set of recent college graduates. They were given the exact same scenario and given AEDs. Which group do you think did better?
3rd grade.
3rd graders. Why?
Because it was something for them to listen to and play with, basically.
They followed directions. They didn't question it, they just followed the directions. So with the AED, turn it on, follow directions.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light. Apply pads, plug-in connector.
Connector,
Apply
flashing
pad,
light.
analyzing heart rhythm. Do not touch the patient.
Clear.
Shock advised. Charging. Stay clear of patient.
Clear.
Deliver shock now. Shock delivered. Begin CPR.
1, 2, 3. Okay. They have a metronome in them. They beep. Every one of these beeps is a compression. Okay. Some of them actually count for you. They'll beep, then they'll say 10, beep, 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 20, beep, 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 30. Some will actually tell you to give the rescue breath depending upon the features of the model. Most AEDs now are at least bilingual, if not multilingual, so find the language button, scroll through, they can hit play, and it'll talk to them in their native language. Okay. What's the primary purpose of the AED?
And restart the heart, to try to like give some electrical care.
That's the secondary. Okay, shocking and restarting the heart, secondary. The primary purpose of it is to monitor heart rhythm. First thing it does, monitoring the heart rhythm, right? That's the primary purpose. If there's a heart rhythm, then it won't shock. If there's no heart rhythm, or a viable heart rhythm, it will shock. Okay. So, who can remove the AED pads once they're applied to the patient and attached to the machine?
Yeah.
EMS, we're going to say medical personnel. Okay, they'll take care of EMS, doctors, nurses, coroner, medical examiner, all them. Okay. One of the persons that can remove them. Who do you think it is?
Them if they wake up.
What?
Them if they wake up?
Yes. The patient themselves can remove their AED pads. We're all in charge of our own health care, right? If they become responsive and want to remove their pads, they can do that. I will say this. If you have brought someone back using CPR and an AED, and they want to remove their pads, it is 100% their right to do so. I would highly encourage them to keep them on at least until EMS arrives. Let them argue with EMS about removing them. That's what we pay the EMS team the big bucks for, right? I'm glad someone was a joke. Okay. So if the primary purpose of the AED is to monitor the heart rhythm, okay, what's your heart rate like during an emergency? Yeah. We'll say elevated and strong. Okay. So if you have an elevated and strong heart rate, and you are accidentally touching the patient when it goes to monitor the heart rhythm, there's a slight probability the AED will read your faint heart rhythm as your strong heart rate as a faint heart rhythm for the patient. In which case the AED will not shock, as they continue CPR if needed. Really bad for the patient, not too bad for you, right? Except you're doing 2 more minutes of CPR. That's the least likely to happen. What happens more often, or more frequently, or higher probability of happening is, you have elevated heart rate, it doesn't read your heart rhythm, it advises to shock, you're still touching the patient. You or the person running the AED pushes that shock button. How many patients are there when EMS arrives? 2. The original patient and you. Don't become the second patient. Okay? Any questions about the AED? Infant pads. They're smaller. Okay? How do I apply infant pads to an infant? Front and back, yep. Let's say I open up the Aed Kit. Have Mr. Jones here. He's 60 years old or whatever. And all I have are infant pads. Can I use those infant pads on Mr. Jones? You've been doing CPR for 2 minutes till someone get back with the AED, you open up, all there are infant pads. What are you gonna do?
Use them?
No. You're gonna continue CPR. You cannot use infant pads on an adult. They don't provide a high enough level of shock to restart an adult heart. Okay? They are only for infants. Do not try to use them on an adult. Okay?
Can you use the adult pads?
Save that thought. I'll get there in a minute. You're jumping ahead. Okay? So let's say I open up the Aed Kit, and I have a 9-year-old. If there are already youth pads in there, follow manufacturer instructions. You open up, there's infant and adult pads. Which ones are you going to use?
Adult.
Adult pads, how are you going to apply them?
The same way you apply the adult, it depends on what their weight size and their chest.
Depends upon their size, exactly. Initially, you'll apply them in the same location as an adult, unless they're going to be within 2 inches or touching. If they're 2 inches, within 2 inches of each other or touching, you'll place front and back. Okay? If you place them and they're more than 2 inches away, good to go. Okay? So let's say I open up the Aed Kit again. I have a 8-month-old in front of me. All I have is adult pads. Can I use them? Yes. How are you going to apply them?
Front and back.
Front and back, yeah. Infants will always be front and back, okay? And think of this, adult pads are your universal sets of pads. You can use them on anybody. It's just how you apply them, okay?
As far as like compressions go, you're saying infant versus adult. So like what if I had like a 13-month-old? Would we do still like that, or we would do normal compressions?
You can do normal compressions,
Okay,
yeah. You have to,
okay.
if you did infants on a 13-month-old,
Am I
it would
not-
still probably work, but
Oh, okay.
you should be doing the regular ones.
Okay, so
Okay.
probably up until a year.
Yeah, at a year is the difference. So adults are over 12, okay? Youth category is 12 to 12, 12 months to 12 months to 12 years. Then infants are 12 months and under.
Okay.
Okay. How many compressions to breath are we going to do for a youth?
33.
30 to 2. What about for an infant?
33.
32. It's all the same. Okay. So we come across someone, they're responsive, we're talking to them. What acronym do we use to find out what's going on with them?
Oh my God.
Sam?
Sample, yeah. These are questions, right? So you say, I'm going to help you out. So S's, what's S?
Symptoms.
Signs and symptoms, yep. A, allergies. What allergies do you need to worry about? All of them. You need to worry about all their allergies, right? Because if they've been exposed to that allergen, that might be causing the problem, right? So you need to worry about all of their allergies. A couple I can give you hints on that might help you. If someone tells you they're allergic to bananas, treat them as if they have a latex allergy, okay? If they tell you they're allergic to shellfish, do not use iodine-based products on them to clean cuts and wounds, okay? The other one that people are becoming allergic to or becoming more prevalent is people are allergic to adhesive. So if someone's allergic to adhesive, what can't you use?
Tape.
What?
Tape.
Cannot use tape or Band-Aids. Okay. Yes, you can use the Aed pads. That's usually what someone says, oh, you can't use the Aed. No, you can use the Aed, you can't use tape or Band-Aids, okay? M. Medications, yep. So let's say if someone tells you they're taking a medication that you've never heard of and you don't know what it does, what should you do? And I will tell you, Googling it is not the right answer.
Ask them.
Ask them, thank you. They're talking to you, right? Hey, I take whatever. Well, what does that do? Why do you take it? What is that? Okay. P. This is the sometimes tricky one. Pertinent medical information. Okay, and the reason why we take pertinent medical information is if you have an older patient and you ask them for their prior medical history, you'll get the entire history of their entire life of every problem they've ever had. You don't need that. You need their pertinent medical information. Okay? L.
What led up
Save that idea. Next one. L.
to? Last food and drink.
Last time they had them to eat or drink. Yeah. Why would you want to know that?
Because
It can help diagnose some things,
Yeah.
yeah. And then E, events that led up to the situation or whatever they're in, right? Question, can cardiac arrest lead to a heart attack? Who says yes? Raise your hand. Who says no? Raise your hand. Who's unsure? Raise your hand. Kind of figured I'm going that way, right? Cardiac arrest cannot lead to a heart attack. Cardiac arrest is cardiac at rest. The heart's not beating. So if the heart's not beating, what are they?
Dead. Oh, not, well,
They're dead. Yeah, technically they're dead.
I didn't mean to say it like
The brain can still be functioning, okay, but they're on their way to death. Can you make their day worse?
No.
No,
No. If their heart's not beating, what are you doing?
you gotta start the CPR.
You're doing CPR. That being said, when you give CPR, you may feel or hear a snapping, cracking, and popping sound. Typically, it's the cartilage between the ribs that are breaking. In older patients, it will be the ribs breaking. Don't stop. Okay? Because when we're giving CPR, we are manually pumping the heart and pumping the blood to oxygenate the vital organs in the body, right? What is the vital organ we are typically trying to save? The brain. Okay? We need to keep that blood flowing to the brain. Okay, and that's what we're doing when we're giving CPR. Okay? Any questions? So what are some signs and symptoms of a heart attack?
Pain and
Chest pain, chest tingling.
So tingling, left arm, I'm guessing I saw someone point to arm and I heard tingling, I'll put it together. What else?
Coloration,
Okay, what color are they gonna be then?
like a grayish pale.
They'll be pale, yeah. Pale, left arm pain, possibly tingling in their left arm, what else?
confusion.
Confusion, yeah. What else?
Vomiting, maybe?
Can be vomiting, yeah.
Sweating.
Sweating, what kind of sweating?
Profusely.
Yes. But it's usually a cold sweat. Okay. Anything else? I think this is really funny. This happens quite often. Sorry, I'm going to offend the male population in a minute. A group of ladies and with one gentleman in the room. I'm not counting myself because I'm the instructor. You gave me all the signs and symptoms of a male having a heart attack. There's only one that is usually for both. Okay? I'm going to let you in on a little secret. Women, statistically, have a higher tolerance for pain than men do. Okay?
I was talking because it's childbirth.
Ask me after class, I had a nurse tell me I know what childbirth feels like. I had back spasms for 14 hours with my knees being pulled to my chest. Okay? The nurse came in the morning, you know what childbirth feels like? I said, whatever. It hurts. All right? Women and men present heart attack symptoms differently. Okay? You've given me most everything that a male would go through. The other one would be tightness in the chest and trouble breathing. Women can have all the, what we think of typical heart attack symptoms, but it's usually later in their heart attack cycle. Okay? So what are some signs and symptoms of a woman having a heart attack?
Also sweating, like having hot flashes.
It can be.
You throw up like a.
Throwing up, nausea, vomiting, lower back pain, jaw pain, and insomnia. Oh, and by the way, flu-like symptoms. What does that list sound like? I can give you a list of 20, 30 different things, right? Here's the thing. If you think that a woman is having a heart attack, or could possibly be having a heart attack, make sure they're seen. If a woman has a heart attack, she's more likely to die from it than a male is. And why do you think that is?
People don't know the symptoms.
They don't know they're having a heart attack, so they don't get seen, right? They think it's the flu or whatever. If a male's having a heart attack, you know he's having a heart attack, okay? So what are we gonna do for someone we suspect is having a heart attack, has all the signs and symptoms? We're gonna assume they're having a heart attack. What are we gonna do for them?
If they can chew and swallow, give them aspirin.
Yep, give them 4 baby aspirin or 4 81 milligram aspirin. They're usually chewable. The reason why I have to call baby is because they're a baby dose, not that we should give them 2 babies. Okay. What else are we gonna do? Real important one. Call 911, good job! What else are we gonna do for them?
Make sure they're like sitting comfortably.
Yeah, put them in a comfortable position. If they're having trouble breathing, make it easier for them to breathe. If they're wearing a collared shirt, open it up, whatever, make it easier for them to breathe. Okay? Call 911. One other thing we can do for them. If they have been prescribed nitro or nitroglycerin, we can have them administer it, self-administer it. By self-administering it, means you go get it, you hand it to them, they take it. Okay? One thing you need to ask a male is if he has had an ED medication in the last 24 hours before you give him the nitro. If a male has had an ED medication in the last 24 hours, he cannot take the nitro. It says it on his nitro, also says usually on his heart medication or on the ED med. Okay? Really simple. Ask him, have you taken an ED med in the last 24 hours? Yes or no? No. Here's your, if they tell you they're taking it, right? Just, hey, have you taken it in the last 24 hours? If they don't mention it, then give them their nitro. Okay? Nitro opens up all the blood vessels in the body, helps the blood flow easier. Okay, it'll help reduce the symptoms of a heart attack. They don't need to go to the hospital to be treated. Okay. Any questions about heart attacks, cardiac arrest, CPR?
Just so that I can hear clearly, do or do not give them the nitro?
If they have taken an ED medication within 24 hours, do not give them the nitro.
Okay. Thank you.
ED medications were initially developed as a blood pressure reducing medicine. Nitro is a vasodilator, opens up all the blood vessels. So if you take a blood pressure reducing medication and you take nitro, you bottom out the pressure. Not a good combination. Okay. Any other questions? All right. So let's say someone's having a seizure. What are you going to do?
Clear the room, make sure everything's clear.
Yeah, clear everything out of the way, right? Make sure it's safe for them. You gonna hold them down?
No.
No, don't do that. What else are you gonna do? Having a seizure, you clear everything out of the way. What are you gonna do now? Call 911. All right. After you call 911, go ahead and grab a safety pin their tongue to their lip, right?
No.
You're right. Don't do that. We don't teach that anymore. It has not been taught for a number of years.
They used to have you safety.
What?
They used to actually have you safety pin.
Yes, they used to teach that. My very first aid CPR class. Yes, I'm a little bit older. My great grandmother carried safety pins on her blouse because she had epilepsy.
Oh, wow.
Okay? Do not do that. Okay? After they're done seizing, what are we going to do?
You okay?
Yep, thank you. You're going to check for responsiveness. If they're responsive, what are we going to do? We're going to place them in the recovery position, right? Raise the left arm up, turn them onto their left side, bend their arm, bend their leg. Okay? And wait for EMS. Okay? Type of diabetic situations or conditions, what are the two that you can encounter? Hypo and hyper. Luckily for you, it's pretty easy to treat them. You treat them the same way. What do?
Give them sugar.
Give them sugar. Yep. Let's say you give them sugar, and in 10 minutes, no improvement. What are you doing now? Call 911, because what are they? They're hyper. They're hyperglycemic, not hypo. If you give if someone's hypoglycemic and you give them sugar, you'll see an almost immediate response. Okay, within 10 minutes, they should show signs of improvement. You can give them more if needed. If there's no change, they're not hypo, they're hyper. Okay, they need to be seen at a medical facility. Okay?
What do you go about testing, or do you just go according to what you see?
Well, what you see.
Okay.
You know what to tell the difference is with a blood test. Who can give a blood test in the room? Raise your hand. All right.
I'm asking that question because my mother's a diabetic, and sometimes she's hyper and hypo. It just depends on, like, her glary eyes, her
Yeah.
sweating, she's sweating, it's either too high or too low for her. either
Right.
or, and she takes some
Yeah.
medicine or whatever the case may be.
Yeah.
So,
I mean, when we're talking hyper, we're talking way super high. You know, yes, people get out of whack a little bit and they can easily adjust. Well, you know, when you get down to hypo, someone's really going low, you're gonna see the changes in attitude, those type things.
that's
You give
funny
them-
for her, but.
Okay, but if you give them sugar and then, you know, it kind of normals out, they were hypo. Now, if you give them sugar and nothing happens, then they're hyper and give them medical treatment. Because once it gets too high, they can't give themselves insulin. It'll actually cause more damage. They can send them into hypoglycemic shock really quickly. Okay, that's why if they're too high, get them treated as a slow drip. Okay, probably a little more information. All right. So heat-related situations. There's a couple of them. What are they?
Heat stroke.
Heat stroke, top of the ladder. All right.
Cramps.
Heat cramps. Yep.
Um,
Two more.
shoot.
What's the least severe of all of them? Guaranteed everyone's been at least once in your life.
Sunburn?
What?
Sunburn?
No, that's a burn. That's a radiation burn.
Heat exhaustion.
Heat exhaustion's one. Yeah. There's one more that's lower than heat exhaustion. You gotta hear what- anyone ever been? Dehydration, yeah. If you ever had the flu, you've been dehydrated, right? So what are you gonna do for someone with dehydration? Yeah, get them fluids, right?
Yeah.
Okay, when I say fluids for today, I'm talking non-caffeinated and non-alcoholic. Okay. Water, electrolyte drinks, sports drinks, coconut water, whatever. Okay. Heat cramps is kind of like, along with dehydration, it's not as severe as heat exhaustion. If you're dealing with youth and someone has heat cramps, get them hydrated, but follow youth protection policies on touching them and massaging the cramps out. Okay. Heat exhaustion. What are the signs and symptoms of heat exhaustion?
Sweating.
What?
Sweating.
Sweating, yes.
Dizziness.
Can be dizziness. Heat exhaustion.
Feeling tired.
They're tired, all right. What else?
Pale.
Pale, yep. What else is the skin? The skin's gonna be pale,
Burn,
Warm.
Dry, cold,
cool. Yeah, and they're still sweating, so it's gonna be what?
moist.
Clam.
Moist, clammy, yeah. They're gonna be, it's gonna be pale, cool, and clammy. They're gonna be tired, lethargic, not feeling well. They're gonna have nausea, could be vomiting. Okay. What are we gonna do with a person with heat exhaustion?
Wrap them up in a blanket if they're cool.
Well, they're cool sweating. They're still, you get them out of the heat, okay? You get them into an air-conditioned building, get them in the shade, those type things. Let them rest and get them hydrated. Okay, electrolyte drinks, sports drinks, those type things. Yeah, you need to get them hydrated. Here's the problem. They're nauseous. How likely are they to want to drink?
Not at all.
Very.
Not much, right? Whatever, get a cup, put a little bit in a cup, have them start sipping that, and just keep refilling the cup and have them sip on that. As they get more and more fluid in them, they'll start to feel better, and you can get more fluids in them. Let them rest anywhere from 1 to 24 hours to get fluids into them, they'll be fine. Okay? What are the signs and symptoms of heat stroke?
Dizziness.
Dizziness,
Confusion.
confusion,
Pale skin.
what?
Pale skin.
Skin's not pale.
Like a redness, burnt color.
Red, yeah, skin's gonna be red. So what does red skin feel like? Hot! What else? Red, hot, and dry. Why would the skin be dry?
It's holding on to the fluid.
They're not sweating anymore. This is the key indicator. They are not sweating anymore. Skin can be red, hot, and dry. They are not sweating. They will have a headache like they've never experienced before unless they've had migraines or a cluster headache. That's what causes the confusion, the dizziness, those type things. It can be nauseous, cannot be. Heat exhaustion is a medical emergency. The internal core temperatures reached at least 102 degrees. What happens at 105? Anyone know?
Frying the brain. Sure.
Yes, the body starts cooking itself from the inside out. This is a medical emergency. What are we going to do for them? Call 911. Yep, what else?
Try to cool them down.
Try to cool them down. How?
Like a little damp cloth, like.
Yeah, damp cloths, mist them down,
Yeah.
cool towels around the neck, in the arm area, in the groin area, and around the chest area, okay? Do not take a bucket of ice water and dump it on them. You will send them into shock. Don't do that, okay? You can give them cool beverages as well, okay? Opposite of heat stroke. Hypothermia. Question, does it have to be cold to get hypothermia? No. So give me an example when it doesn't have to be cold to get hypothermia.
You dump that bucket of ice water.
You're actually correct. Water will draw the heat out of the body a lot quicker. Okay, so if you think about someone in the spring, they're out on the water somewhere, they fall in, the water's a lot colder. Or if it's just raining and you don't have proper equipment and it's only like 70 degrees out, and they're outside without proper equipment, they get hypothermia. Okay. So what are the signs and symptoms of hypothermia?
Shivering.
What?
Shivering.
Yeah, shivering, because they're cold, right? They're shivering. What else? What's the skin like? Cold, yeah. What else? What's the color of the skin? Pale. It can have a slight bluish tint to it sometimes. That's more moderate, moving into severe hypothermia. Okay. We also have what we call the umbles. The eyes will be glossy too, and the umbles. The umbles are they're mumbling, they're grumbling, they're fumbling, and they're stumbling. Okay, they're losing their fine motor skills because they're so cold and they're shivering, they can't do stuff. What are we going to do for someone with hypothermia? Warm them up, right? If they got wet clothing on, get all the wet clothing off and get them in warm clothing or dry clothing and start warming them up. When you start warming them up, if you can use layers of blankets, that's better than a big, if all you have is a big bulky one, use it, right? If you have layers of blanket, it's better because as they start to warm up, you can take a layer or two of blankets off until keep them warm. Again, hypothermia is a medical emergency. Activate an EMS system. Okay. What other cold weather condition could you encounter?
Frostbite.
Yeah, frostbite. Who's had frostbite before? Raise your hand. That's what I get for growing up in New England. All right, what's frostbite look like? So initially, who's ever been outside and your cheeks and your ears get red, they start tingling and burning? Anyone ever had that? That's actually frost nip. That's the beginning phases of frostbite. Okay. Really, you go inside to get warm, you're fine, right? From there, so frost nip is just the epidermis, the top layer of skin that's starting to freeze. And mostly that's made up of dead skin cell tissue, so not a big deal, but it still kind of hurts because there's still some living ones, but not much. From there, you'll start to get into the dermis freezing, okay, and it'll turn pale. It'll turn white, it'll look waxy, like all the color is drawn out of it, it's white. From there, it starts to get more stiff. Blisters will start appearing, and then it'll become frozen solid. It'll be pale, okay? Those little blisters that are forming are the ice crystals that are pushing up into the skin, okay? Who's had frost on their windows before? What does frost look like? Looks really nice, right? All those crystals. What do the end of those crystals look like? Kind of sharp and pointy, right? Well, that's what's happening in this. Those are the same ice crystals that are forming in our skin and everything else. Those are the water crystals in our body that are freezing. Okay. So how are we going to treat frostbite? Mild frostbite. If it's full thickness, get them to an emergency room. Okay. But mild frostbite, how are you going to treat it? Warm it up, right? Water. Warm water, right?
No.
Who's defrosted shrimp before? How do you defrost shrimp?
You use lukewarm water.
Warm water, right? Why don't you use hot water to defrost shrimp? They'll cook the outside before the inside's defrosted, right? Well, let's say someone's hands, fingers are frostbitten. We're not going to cook their hand in hot water, right? Well, what could we cause?
More damage.
We could kind of, yeah, we could burn it, right? Because they can't feel it. So if they can't feel the hot water we're putting their hand in, if it gets too hot for them, what aren't they going to do?
They're not gonna figure it out.
They're not going to pull it up because they can't feel it. So if you're going to submerge the frostbitten area into water, put your hand in that water for 30 seconds. If you can keep your hand there for 30 seconds, it's good for them. Make sense? Okay? That's what we don't want to do. The other thing you do is you can hold it. Okay, skin to skin contact, and put their hands underneath their arms. Do not rub a frostbitten area. If you start rubbing it and it's frostbitten, what are we doing? Moving all those ice crystals around on the inside of there, trying to warm it up, right? Don't do that. Okay. So I'm cooking with my younger son the other day. Go to reach to take the cookies out of the oven, hit my hand against the side of the stove, it's all red. What's that called? A burn. Yeah. Not a complicated question. What are we going to do for the burn?
Put it under,
Put it under cold water. For how long?
30 seconds?
10 minutes?
20 minutes. Now, I know, that seems like a long time. Who's gotten burned before and stuck it under cold water? This is how it goes. Cold water's on. Yeah, okay, yeah, it starts feeling better. All right. Oh man, I still got more stuff to do. It's been about 45 seconds, I pull it out. What happens a minute later? Starts hurting again, right?
Yeah.
What do I do then?
Stick it back on there.
You're the smart one. What do most other people do? They forget it because it's a burn, it's gonna hurt, they go on about their day, right? If they'd run under the cold water for the 20 minutes, 15 to 20 minutes, what that does is draws all that heat out. So we stop the burning process. So if we stop the burning process, causes less damage, right? So if there's less damage, what else is there? Less pain, quicker healing. Leave it under the water for 15, 20 minutes. Okay? Let's say I'm not as quick. Go take those cookies out again, hit my hand against the side of it. The oven's hotter this time. It's all blistered. What are we going to do now?
Wrap it with the ace bandage loosely.
You need to still cool it off. Cool, moist bandages, wrap it around loosely. You want to cool that out. You want to draw the heat out still. You don't want to run it under the water. So what's the water from the faucet going to do? Pop the blisters. You do not want to pop those blisters pop, but you still need to cool it. After it's cooled, wrap it in a dry, loose bandage. Okay? So I went to go fry a turkey for New Year's Eve. Got a big pot of oil sitting on a burner. Got the turkey. Well, it's not quite defrosted all the way. Put it in, it flows all over the place. I gotta turn off the gas. I slip, I fall, put my hand out to break it. I hit the burner of the stove. My hand is all charred. What do we call that?
Full thickness burn.
Full thickness burn, 3rd-degree burn. What are we gonna do for it? What?
Go to the hospital?
Call 911.
Call 911.
Call 911, get an emergency room. They're going to a burn unit. Okay. Who's ever heard that 3rd-degree burns don't hurt? Anyone ever heard that? Why don't they hurt supposedly?
damage the nerves.
You've burnt the nerve endings. So if I burnt the nerve endings right here, it's not going to hurt right here. But what's all around of it?
Pain.
Pain. Yeah. Let's say someone has blisters on their nose and mouth from a burn. What are we going to do?
Send them to the hospital.
Call 911. Yeah, we need to get them to the hospital. Why?
Well, nothing else you can do. You can't run water on it.
Right, you can't run water on it. You can cool it off as much as you can, but also they could have damaged their airway. They could have burnt their airway, and you don't know that. Okay. If that airway starts swelling closed, it's a lot harder to manage later on. Get them immediate help. Okay. What happens if the person blistered the bottoms of both their feet? What are you gonna do?
Call 911.
Call 911. They're also going to a burn unit. Impacts quality of life. 'Cause what can you really do with both of the bottoms of your feet blistered?
Nothing.
Nothing. What happens if both your hands are blistered from burns? What are you gonna
Have
do?
someone call
Have someone call 911, exactly. Hey Alexa, call 911 for me, please. Okay. Again, they're going to a burn unit. They can't do anything. Okay. Groin or genitalia, blistered from burns, call 911. The feet, groin, genitalia, and hands all impact your quality of life. That's why they're going to a burn unit. Okay. All right. How many compressions per minute do we have to do?
30.
Per minute.
Oh, 100 to 100.
100 to 120. How do we determine that we're giving 100 to 120 compressions per minute? What song?
Staying alive.
Staying Alive. Great song. Now, if you can sing, count the number of compressions you're doing and the number of cycles, you're way better than me. Okay? The way I learned is I count 1 and 2 and 3 and 4 and 5 and 6 and 7, etc. up to 30. Okay? Well, we're going to do the practice round here in a minute. You will approach the patient. You will check the scene. You'll check for responsiveness. You'll check for breathing, then you'll tell me to call 911. The first cycle we're going to do together, I'm going to count it for you. I will count to 15. When we get to the rescue breaths, we're going to simulate rescue breaths today. Don't know why, but we're going to. You want to figure out why we're simulating rescue breaths?
So we don't have to listen to.
Well, we all have masks on anyways, right?
Yeah.
Also, in COVID, American Red Cross is saying you can do breathless CPR. Okay. So all you do is tilt the head, pinch the nose, breath, 1/1000 breath is how we're going to simulate the breath today, okay? You'll simulate the first 2 rescue breaths. The second cycle, I'm going to start counting for you. I will count to 15. You will finish to 30, give your 2 rescue breaths, and then do 1 cycle on your own. Okay, this is your practice round. I'm going to be walking around, make sure your hand's in the right place, you're doing compressions correctly, you have the right pace, right depth, all of that. Okay? The other song that you can sing, I personally find kind of morbid, but hey, it's still a great song. I like it, just not for doing CPR. Anyone know what the other one is? Another one bites the dust. All right? So either one that you want to do, you might get if you want to. All right? I'm going to count. All right?
Yes.
All right. If your mannequin is going in a way that you don't like the head is going the opposite way and you don't like doing it that way, you want to go the other way, change it. Not a big deal. Okay? Go ahead and put your gloves on. All right, go ahead and approach your patient. Check the scene.
Are you?
All right, scene is safe. Go ahead and check for responsiveness.
Are you okay?
Okay. Are you okay?
Are you okay?
No response. Go ahead and check for breathing. Yep, none of them are breathing either. If they were, I'd out of here quicker than you are. What are you going to do now?
Start trust professionals.
All right, go for it. You don't want to do anything else first? Remember, I'm counting this one for you. I'm counting this one for you. I'm counting this one for you.
How do I go call
Oh, call 911 AED. All right, get ready to begin chest compression. Begin 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15. Give your 2 rescue breaths. All right, this cycle, I'm going to count to 15. You will finish to 30. Give your 2 simulated rescue breaths, then do 1 cycle on your own. Alright, again, 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11, 12, 13, 14, 15. The cycle's on your own, don't let it go. I really like Ralph there. He's a good friend of mine. All right, good job. How did that feel? Can you do it for 2 minutes?
No.
What about 7 minutes? 9 minutes?
I like to that between the 7 to 5.
Yeah. All right. If you want to sit back in your chair and review a couple things.
Yes, please. This one's not comfortable.
All right. How do you tell if someone's choking? Yeah, if they're doing this, right, it's a pretty good sign they're choking. Let's say they're doing this and they're coughing. What are you gonna do?
I'm gonna hit them on the back.
Actually, they're not choking they're not actually choking because they're still coughing.
Yeah.
As long as they're coughing, they have air going in and air coming out, all right? So what you're gonna do that is to say, hey, I'm Chris, I'm an EMT, can I help you? You're getting consent from them to help them, okay? And you say, you're doing a great job, keep coughing it up, keep coughing it up, keep doing it, good job, cough harder, cough it up, I know you can do it. All you need to do.
Encourage them, okay.
But don't say, Chris, you're an EMT, use your name and your certification level, please. It'll save you a lot of hassle. And then not people are gonna come looking for me. Once they stop coughing is when we're gonna really take action. So they were coughing, it didn't come out. Now they're not coughing. What are we going to do?
Ease them down to the ground. Only if, I guess if they pass out.
Only thing going on, we're not there yet.
Okay.
The 5 back.
Yeah, we're gonna do 5 back blows. We're gonna do one thing before we do the 5 back blows, or simultaneously as we start doing the back blows.
The helmet? Or?
We're gonna send you and the Jazz, go call 911. Okay.
And it's AED, right?
This just wants to go get, yeah, you could go get 911 and they're choking though, so.
Okay.
We're gonna do back blows, okay? So you're gonna stand perpendicular to them. So your shoulders even or slightly in front of them, reach underneath their arm and hold their other shoulder, bend them forward so they are parallel to the floor. And 5 back blows. Okay. If that doesn't work, then what are we gonna do?
Abdominal.
The abdominal thrust. Where do we place our hands for the abdominal thrust?
Below the navel.
Right above the belly button, right? The navel. What's the easiest way to find the belly button or navel on anyone? Anyone know? Go ahead and point to your belly button. I'm going to give you 5 abdominal thrusts. See how easy that was? Half the room did it. If they can't or won't point to their belly button, I'll give you a little trick. The top of the hip bones, straight in front, will always lead to the belly button. Go right above it, in perfect positions. The other thing you want to do is make sure you have a foot, one of your legs is in between theirs and you have a good stance. Why do I want my leg in between theirs?
So that it,
If they become unresponsive, where are they going?
Down.
Down and forward, right? If my leg's not here, where am I going?
Down.
Down with them. And how many patients are there when I show up? 2. Don't become the second patient. Okay? Reach in front, right above the navel, in and up 5 times. Okay? It's a J motion. The other thing is, do not have someone standing in front of them. The reason being, the object can travel up to 20 feet. Okay, the last thing you want to do is have someone standing in front of them and they get amazed at how it came out. They go,
And then
now you got a second patient. Okay? So you do the 5 back blows, 5 chest thrusts, 5 back blows, 5 chest thrusts. Let's say they become unresponsive. We've laid them down. What are we doing now?
CPR.
Immediately begin chest compressions, right? 1 and 30. We will then open the airway and we will look to see if we can see the object. Do the head tilt chin, look into the mouth. See if we can see that object. If we can see it and we can safely remove it, we will. What was the key word there? Safely. One finger, sweep it through the mouth. We can take it out, great. As a general rule of thumb, it's the teeth area is a safe distance, so you can pretty easily remove it. If it's behind the teeth, you gonna try to remove it?
No.
No, thank you. Okay, you're not going on a fishing expedition to try to find it. You can push it further back down. Okay, and all the work you've already done, you've just canceled it all out. Don't do that. If you can't remove it or can't see it, give a rescue breath. If it goes in, wonderful. Give a second one. If it doesn't go in, reposition the head, try again. If the second one doesn't go in, resume chest compressions. If the second one goes in, resume chest compressions. See how simple that is? Okay? Any questions about the adult choking procedure? Okay. Next, infants. Now, infants, they never end up choking because they never put stuff in their mouth, right?
Yeah.
Pick the infant up, have them straddle your arm, support their head. Don't cover their face, it will freak them out. Besides, when the object comes out, it will come out to your hand, they will re-swallow it and put it back in their mouth when you're trying to process all over again. Support their head, put them at a downward angle. You want the shoulders below the hips. Shoulders below the hips. If you're sitting down, you can use your leg to support them. Okay, or if you're standing, you can still use your leg, however you want. Shoulder, flip them over, 5 back blows, 5 chest thrust, okay, until they become unresponsive or the object comes out. The key to having them at a downward angle is gravity is helping you. Use it to your advantage. It's free, it doesn't cost anything. Use it, okay? If they become unresponsive, we're going to do the exact same thing we did for the adults. We're going to begin chest compressions, do 30 chest compressions, check the airway, and do CPR. Okay. Any questions about choking? For youth, youth are simple. They're small adults. Get down on their level. All right? Don't try to do it from standing up. Kneel down, get to their height. Okay? Any questions about choking? All right. So, you know, I'm retired Navy. We have these things in the Navy called door knockers. You hit them with your chins, they really hurt. Okay? So you hit one, you cut your shin open. Alright? What are we going to do for someone bleeding?
Put a bandage on it.
Direct pressure, right? Alright, we got a bandage here. Let's say I bled through the first one.
Put the second one on.
Put the second one on? Don't take the first one off?
No.
Really?
Really?
Yeah, you're right, you don't. Keep adding them on. The reason why you don't want to take it off is any clotting has already happened. When you take that bandage off, you're ripping that clotting away. Okay? So you take some rolled gauze, wrap it around. Yes, I'm doing my pant leg in this. Alright, roll it around. I'm going to show you a little trick. Let's say you don't have any tape with you. What are you going to do with this? What are you going to do? How are you going to tie it? Right, tie it. So, see how I got it out over the top? I will cut it in half. Make it longer, cut it in half, bring it up. Now I have 2 ends, and I can tie it directly over the cut. Okay? Good? All right. Any questions?
I like the, can you show me the tie again?
Right?
Because on the computer didn't show that, just showed me slide the knot over it.
Yeah, I know. That's why I do it. So you have the bandage over whatever the top of it is, and you stretch it out, cut it in half with your finger. You're just creating a loop. Now you have 2 ends, then tie it. Okay. All right, yeah, I know, it's really easy. Grab that knot on the computer screen, slide it over, you're good to go, right? Works real well in real life. There's always just stuff over here I can just grab and pull out of thin air, right, when I need it. Okay, so what we're gonna do, the first scenario I'm gonna give you will be an adult CPR situation, okay? You will do approximately 2 minutes of CPR, okay? At about 2 minute time frame, I will tell you to go ahead and apply your AED. At that point, go ahead and apply, turn your AED on, and apply the pads, okay? Follow the instructions. Be a third grader. All right, after it shocks, you can turn the AED off and take the pads off, okay? We will then do a youth choking and CPR scenario, and then we'll do a bandaging one. All right, now we have an activity that I will show you how to take off gloves so you don't contaminate yourself, and then you'll be done. All right, any questions? All right, you are out shopping at your favorite grocery store. You're in line, and there's an elderly couple in front of you, and the husband collapses in front of you. Go. The husband collapses in front of you. You're in the shopping line. Help him.